Every year, millions of American men walk out of their doctor's office with a life-changing piece of news based entirely on a test result that was completely wrong. Up to 30% of elevated prostate-specific antigen readings, what we call high PSA, are what doctors call false alarms, caused not by disease, but by simple, everyday mistakes men make in the 48 hours before their lab appointment. I am Dr. Carl, a practicing urologist with 16 years of experience helping men navigate prostate health and aging. Today, we are walking through 6 dangerous prostate exam mistakes that men over 60 make every single day, mistakes that lead to unnecessary panic, invasive procedures, and sleepless nights. We will cover the hidden vitamin in your medicine cabinet that throws off lab tests, why your morning routine before a blood draw matters more than you think, and the exact conversation you need to have with your doctor before anyone orders a biopsy. Make sure you stick around for mistake number 6, because it is the single most common reason active retirees get slapped with a false high PSA score. Before we dive into mistake number 1, I want to ask you a quick question. Have you ever had your doctor tell you your PSA went up, only to find out later it was nothing serious? Drop a comment below and let me know how many times you've had a prostate check in retirement. I read every comment on these videos, and your real-life experiences shape what I talk about next. The first mistake millions of men after 60 make is riding a bicycle, playing an intense round of golf, or doing heavy exercise in the 2 days leading up to their annual blood test. Think of your prostate as a soft, fluid-filled sponge sitting right under your bladder. When you sit on a narrow bicycle saddle, work out heavily on a stationary bike, or spend hours bouncing in a golf cart, that hard surface puts direct, continuous pressure on the gland. That physical pressure massages the prostate tissue, squeezing excess prostate-specific proteins directly into your bloodstream. When the lab draws your blood the next morning, your score looks elevated, not because anything is wrong, but because you had a great ride or a good workout 2 days earlier. Research highlighted by the American Urological Association shows that vigorous pelvic exercise can temporarily bump your PSA levels upward for 48 to 72 hours. If you are getting your annual physical, take it easy for 2 full days before your blood draw. Avoid long bike rides, heavy lifting, or rough trail rides. If you forgot and rode 30 miles the day before, just tell your doctor's office and reschedule the blood draw for the following week. Naturally, talk to your doctor before changing any of your routine exercise habits. The second mistake is having sexual activity or ejaculating within 48 hours of your PSA test. Just like mechanical pressure from a bike seat, ejaculate production is the prostate's primary biological job. When you have intimacy, the prostate contracts forcefully to release seminal fluid. In doing so, a small amount of extra PSA leaks past the cellular barriers directly into your blood circulation. It can take anywhere from 24 to 48 hours for those blood levels to settle back down to your true baseline. Studies published in urological literature consistently show that sexual activity can spike PSA readings temporarily by up to 1 or 2 full points, which is easily enough to move a normal result into the red zone. The action here is straightforward. Set a reminder on your calendar to refrain from intimacy for 2 clear days before visiting the lab. It is a simple step that saves you weeks of unnecessary anxiety. As always, discuss any concerns about test timing with your healthcare provider. The third mistake is taking hair, nail, or multivitamin supplements containing high doses of biotin right before your appointment. Biotin is vitamin B7, and it is added to almost every modern multivitamin, joint formula, and healthy aging supplement on the pharmacy shelf. But here's what most seniors are never told. Many major commercial blood testing machines use biotin as part of their chemical testing process. When you have high levels of biotin circulating in your blood from a supplement, it binds to the test reagents and tricks the machine. Depending on the specific lab equipment used, biotin can cause your PSA test to read falsely low, hiding a real issue, or cause other hormone tests to spike wildly. The Food and Drug Administration issued official safety alerts warning doctors and patients that high-dose biotin supplements significantly interfere with laboratory immunoassay results. Check your supplement bottles at home today. If you see biotin or vitamin B7 listed, speak with your physician about stopping that supplement for at least 3 to 5 days before any scheduled blood work. Never stop taking prescribed medications without your doctor's guidance. The fourth mistake is reacting in a panic to a single elevated PSA score without looking at PSA velocity or free PSA. A single blood reading is just a snapshot in time. It is not a complete movie. Your prostate fluctuates in size and fluid output due to age, seasonal changes, or mild inflammation. What matters far more than one isolated number is the speed at which that number changes over time, what urologists call PSA velocity, and how much of that protein is floating unbound in your blood, known as free PSA. Think of it like watching the stock market. A one-day drop doesn't tell you where the market is going, but a 3-year trend line tells the whole story. Clinical guidelines from the American Cancer Society and Mayo Clinic state that a rising trend over multiple years or a low percentage of free PSA provides a far more accurate picture than any single annual physical result. If your doctor tells you your PSA went from 3 to 4.5, do not panic. Ask your physician to order a free PSA percentage test and schedule a repeat PSA in 8 to 12 weeks to verify the trend before taking any major steps. Let us pause for just a quick second. If this is helping you understand your lab numbers better, go ahead and hit that like button right now. It helps YouTube share this crucial information with more seniors across the country who need to hear it. And while you are there, leave a comment letting me know if your doctor has ever explained free PSA to you during your visits. The fifth mistake is getting a PSA blood draw while you have an undetected urinary tract infection or mild prostate inflammation. As men get older, the prostate naturally enlarges, a condition called benign prostatic hyperplasia or BPH. An enlarged prostate can trap small amounts of urine in the bladder, creating a breeding ground for low-grade bacterial infections or localized inflammation. When your prostate is inflamed, it acts like a swollen joint, leaking high amounts of PSA into your bloodstream. A minor, painless urinary infection can send your PSA score soaring into double digits, sending men straight into a tailspin of fear. Reviews in urological research show that active prostatitis or bladder irritation can elevate PSA levels up to 5 times above baseline. If you have been waking up 3 times a night, feeling a slight burning, or noticing a weaker stream, ask your doctor to perform a simple, inexpensive urine analysis to rule out infection before drawing your prostate blood work. Treating a simple infection first can bring your numbers right back down to normal. The sixth mistake, and this is the big one we teased earlier, is skipping the physical prostate exam entirely or assuming a blood test replaces it. Many active retirees tell me, "Dr. Carl, my blood work came back fine, so I told my doctor I don't need the physical exam this year." That is a dangerous assumption. The PSA blood test measures protein concentration, but it cannot feel the physical texture of the tissue. Some aggressive prostate conditions produce very little PSA protein, meaning your blood work could look completely normal, while a small physical nodule is quietly forming on the outer surface of the gland. Think of it like inspecting a car. Checking the oil level on the dipstick is vital, but you still need to look under the car to see if the tire is flat. Research from the American Urological Association emphasizes that combining the blood test with a brief physical examination catches significantly more early-stage issues than either test used alone. Do not decline the physical exam at your Medicare wellness visit. It takes less than 10 seconds, and it provides peace of mind that blood work simply cannot supply on its own. To show you how this plays out in real life, let me tell you about a patient of mine named Arthur. Arthur is a 68-year-old retired civil engineer living down in Naples, Florida. He spends his mornings playing pickleball, taking road trips with his wife, and keeping up with his 3 grandkids. Last year, Arthur went in for his routine annual physical. His blood work came back with a PSA of 6.2, up from 2.8 the year before. His primary doctor was concerned and immediately mentioned scheduling a biopsy. Arthur was terrified. He spent 3 nights staring at the ceiling, wondering if his active retirement was coming to an abrupt halt. When Arthur came into my office for a second opinion, we sat down and retraced his steps. It turned out Arthur had taken up long-distance road cycling that month on his new bicycle, riding 20 miles the day right before his lab visit. On top of that, he was taking a high-potency daily hair and energy supplement packed with biotin. We agreed on a simple plan. Arthur stopped the biotin supplement for a week, stayed off his bicycle for 3 days, and had a simple urine test to clear out any mild irritation. 4 weeks later, we repeated his blood draw. His PSA came back at 2.9, perfectly normal for his age. Arthur avoided an invasive procedure, lost the anxiety, and went right back to enjoying his retirement in Florida. If you are heading into your annual physical soon, here is your 5-step action plan to bring to your doctor tonight. Step 1. Take a 48-hour rest period from heavy exercise, cycling, and intimacy right before your scheduled lab work. Step 2. Check your multivitamin bottle tonight and stop any high-dose biotin supplements 3 to 5 days before blood testing after checking with your doctor. Step 3. Request a routine urine test to check for hidden irritation or infection before interpreting any elevated PSA score. Step 4. Never rely on a single score. Always ask your physician to evaluate your long-term PSA velocity and free PSA percentage. Step 5. If your blood work remains elevated, ask your doctor if a modern, multi-parametric MRI scan is appropriate before discussing any biopsy. Getting your prostate checked doesn't have to be a source of fear when you know how to prepare for your tests correctly. But what about the foods you eat every morning after 60? Next week, we are looking at 3 common breakfast foods that quietly increase bladder pressure and force men over 60 to wake up 3 times a night to use the bathroom. I am Dr. Carl. Stay well, and I'll see you there.